That's a short introduction of this disease. It is affecting almost 9 million individuals worldwide, and it's a major cause of death. And if anybody knows somebody with type of diabetes, I think most of you do, you will also know that it's not just about these numbers, it's also about the burden that this disease brings to your lifestyle. People with type 1 diabetes require to receive insulin externally throughout the day, and this is because their body is unable to produce. And insulin is quite an important hormone. It regulates the way in which our body uses the sugar that is in our bloodstream. The aim of insulin therapy is to try and maintain blood sugar levels within what we call a safe range, the one that we see here in green. And that's because if we go too high, for instance, with a lot of carbs and we don't use enough insulin, then this can result in a series of complications in the long term, such as blindness, kidney failures, cardiovascular diseases. On the other hand, if we don't use enough, if we use too much insulin and we practice sport, then sugar levels could go low, and this means that our body doesn't have enough fuel to work with, and it can result in weaknesses, sweating, blurring, and if persistent, even in serious complications like seizure, coma, or even death. So it's quite important to find the right amount of insulin, and it's not an easy task because it depends on a lot of factors. It depends on our metabolism, our diet, our habits. So insulin therapy needs to be tailored for the specific person. What endocrinologists usually do is they start with one therapy, they see how it goes, and after a few weeks they can decide whether to change it or not. And it's a very long process. It can take up to months. And especially, it's a process that doesn't work very well with kids. And this is because, well, first of all, they're more vulnerable, so there is not much space for making mistakes. And their metabolism is changing, so it's not easy to keep up. They need their parents to take care of them and their disease, and they cannot do it all the time. So our research question here is whether there is a better way to adjust insulin therapy for kids with type 1 diabetes. And we think we might find an answer to that, and it relies on using a technology that is known as digital twins. Digital twins are nothing else but computer simulators that try to replicate some physiological phenomena. In this case, the metabolism of a kid with type 1 diabetes. When we build a digital twin of somebody, we start by collecting their data, and we adjust some numbers in the digital twin until it's able to very accurately reproduce the metabolism of this kid. Once we have this, we can switch from this old paradigm, this trial and error process that endocrinologists do, towards something that is more advanced. We can use digital twins to simulate the effect of a variety of different therapies for a kid and see how they will impact the kid in a way that is, first of all, faster, because it will take few minutes and not weeks, and also safer, because, it's better to test on a digital twin than test it directly on the kid. So after we test all of these therapies, the endocrinologist can choose the best one, or an algorithm can do it in their place, and they can give this to the family. We started a clinical trial to try investigate whether digital twins can actually be used on kids with type 1 diabetes. We enrolled 32 kids, monitored them for 8 weeks, and the results from the first 6 participants that concluded the study have shown that we were actually able to reproduce the metabolism of these kids using digital twins. Now the question is, how do we deploy this into something that physicians can actually use? So we developed this website that we call the FeedUp AI, in which a physician, first of all, can monitor the data from their patients. Here we can see a summary rate. And then they have this console in the website in which they can simulate some adjustment to the therapy. For instance, here, they're simulating what would happen if they were using more insulin throughout the night. This new therapy is sent to a server where the digital twin is, and we run a simulation to see how it will go. And then here, they can see the result with the old therapy in gray and with the new therapy tested on the digital twin in blue. And they can decide if they want to stick with the old one or change to the new. So yeah, we really believe that digital twins can be a promising solution for diabetes care, especially for kids, as they can make an easier job for physicians, and they can improve the quality of life of the caregiver of these kids and the kids themselves. And most significantly, we believe that it can improve the health of these kids. So thank you very much for your attention, and I hope you enjoyed the talk. Thanks.